Hey guys, welcome back after a very long time. And today I'm here with a topic from the pharmacology, that is the ACE inhibitors. ACE inhibitors. What is this ACE? Huh? Angiotensin converting enzyme inhibitors. These become the first line drugs in the hypertension as well as the congestive heart failure. So today we're gonna have a serious discussion over this ACE inhibitors. Now let us get into the video. So the ACE inhibitors include all the prils. So all those drugs ending with the pril are considered, we can just remember them like angiotensin converting enzyme inhibitors, which include the captopril, enalapril, lisinopril, ramipril, fosinopril, and quinapril, and many more. All those which ending with the prils, they are can be just remembered like the ACE inhibitors. So what is this ACE? So and how is it used? What are its effects? So before going to all that stuff, the basic physiology is very important here. So let us get into it. So we know the RAS mechanism which happens in the body. So in this, we're not gonna go very deep. We go to the stuff what all just we need. So the angiotensinogen from the liver is get converted into angiotensin 1 into angiotensin 2, and this acts upon the angiotensin receptors at the level of the blood vessels, causes vasoconstriction. At the adrenal medulla, it causes the release of noradrenaline or adrenaline, and it causes the secretion of the aldosterone that causes the sodium water retention. So this is what the basic mechanism we know from the physiology. So in all this step, this conversion of angiotensinogen 1 to angiotensin 2 requires an enzyme called the ACE, angiotensin converting enzyme, that is present at the level of the lungs. And remember, this enzyme is also required for the metabolism of the bradykinin, which is a potent vasodilator. So be sure with these 2 points. So AC is required for conversion of angiotensin 1 to angiotensin 2 and is also required for the metabolism of the bradykinin. Okay. Now, what happens if we inhibit? What happens if we inhibit this ACE? ACE, if you inhibit, what happens? There will be no formation of the angiotensin 2. There will be no action at the receptors. There will be decreased vasoconstriction. It causes vasodilation that decreases the peripheral resistance and that finally reduces the blood pressure. And what happens? It also reduces the aldosterone. What happens if it is not reduced? On prolonged increase in this aldosterone, it is responsible for left ventricular hypertrophy, or also called the cardiac remodeling. So this is also can be reversed if you inhibit this enzyme ACE. Okay. Now what happened? Why do we use this pills? So this ACE inhibitors, they become the first line drugs in the hypertension, used as antihypertensive drugs and also in the congestive heart failure. Okay, so how it is a useful thing in the hypertension is they reduces the blood pressure by decreasing the peripheral resistance. How is this peripheral resistance decreased? Due to the vasodilation. Why there is vasodilation? It is due to decrease in the plasma angiotensin 2. So, decreased blood pressure is due to decrease in the peripheral resistance. And this blood pressure is not only decreased just because of peripheral resistance decrease, vasodilation, and there is one more reason of the bradykinin. We told ACE is an enzyme which is also required for the bradykinin metabolism. When this is inhibited, there is no metabolism of the bradykinin, and we know this bradykinin is also a potent vasodilator. And now again vasodilation has taken place. Again there is a decreased peripheral resistance, and again there is a decrease in the blood pressure. So why there's a decrease in blood pressure? Due to the inhibited formation of the angiotensin 2 and increased in the bradykinin. And together with that, this left ventricular hypertrophy is also reversed, and therefore it becomes the first line drug in the CHF, and it also increases the cardiac output by decreasing the ventricular afterload. Okay, now let us go to the pharmacokinetics of this AC inhibitors. So they are well observed, and among all of the pills, what I told, the captopril and the lisinopril, they are the only active drugs. Rest all of them are the prodrugs which requires conversion after they enter the body, and they get excreted via the kidney, and therefore their dose has to be monitored in case of the renal failure. Now let us, we just talked about where they are prominently used. Now let us talk about their adverse effects. So adverse effects can be remembered with the mnemonic, that is captopril, captopril. So what does it actually mean here? So C refers to the dry cough. Why there is a dry cough? Because of the increased levels of the bradykinin, which are actually to be metabolized by the angiotensin converting enzyme. And this dry cough is more prevalent in females when compared to the males. In whenever this dry cough becomes a big problem, this ACE inhibitors should be stopped immediately, and you should go with the ARBs. ARBs are the angiotensin receptor blockers, which we will be dealing in the further videos. And second is the angioedema. Angioedema, it will be rare actually, but whenever you observe the angioedema, immediately you should stop this drug course. So how is this characterized as angioedema? You'll be having the swelling of lips, nose, larynx, that may finally make the person land up in the airway obstruction. So that whenever you see the any of the sign of the angioedema, the course should be stopped immediately. And next, P. P refers to the prodrugs. So all of them are prodrugs except the captopril and the lisinopril. And T refers to the taste alteration. There is a dysgeusia, and that is mostly seen with the captopril. Next, O refers to the orthostatic hypotension. So initially when you give the AC inhibitors, there will be a hypotension. This is called the first dose phenomenon. That is the reason why you should start with the low dosage. And if the person is on the diuretics, and this diuretics have to be stopped for temporary purpose and later continued. P. They are usually contraindicated in the pregnancy, that too in the first trimester, because it is a period where the organogenesis takes place, and these produce the teratogenic effects like the malformation, growth retardation, and lung malfunction. R refers, they are contraindicated in the bilateral renal artery stenosis, and I refers to the they are contraindicated in the hypokalemia, because even these drugs also causes the hyperkalemia. It may precipitate, it may aggravate this hyperkalemic condition, therefore they have to be avoided. And they reduces the risk of the diabetic nephropathy. Risk will be reduced. So there may be some of the contraindications, and some of them are the adverse effects. So, and another thing you can see is the rash, which usually they are self-limiting. So these comes the adverse effects. Next, going to the uses. So uses, the first one is hypertension. They are the first line drugs used in all grades of hypertension. And second is a congestive heart failure, where they're again treated as a first line drugs. Second, in the myocardial infarction. In case of myocardial infarction, they have to be started within 24 hours and have to be continued for a few weeks, so that it can prevent the congestive cardiac failure. Whereas the post MI, they are used to reduce the mortality by by reversing the left ventricular hypertrophy or the ventricular remodeling. And they're used as a prophylaxis of the coronary artery disease. It reduces the risk of MI, stroke, etc. On long-term usage, they are known to be reduces the risk of the diabetic nephropathy. So, what are all the precautions you need to take while using this ACE inhibitors? Is they have to be started at a very low dosages because they have the first dose phenomenon. That is, when you give for the first time, there will be a very rapid hypotension, and therefore it have to be started at a low dose and then increased gradually. And it should not be combined with the potassium sparing diuretics because we know that these ACE inhibitors will cause hyperkalemia, and when you use it along with the high potassium sparing diuretics, it will aggravate that. And it also increases the plasma levels of the digoxin. Therefore, while giving it together, you need to be monitored. So guys, this is all about CA inhibitors, which are used as an antihypertensive drug and also for the cardiac failure. Thank you for watching the video. Hope you really found it easier. And for more such videos, let me know in the comment section how did you feel about the video. Do not forget to like, share, and subscribe.